And so, John, I think this is a good time to ask, what in the world is an HDU? Let's start there, and then I've got a couple other questions to help bring our audience up to speed.
So the most concise answer is to direct folks to CSRI's website, which is the CSRI, THECSRI.org. And you'll find the capability model, which prominently figures the definition. I would encourage people not to obsess about the definition, and we could probably have an entire new podcast about the definition and how to apply it. But the answer to your question, the best I can give is that, look, there's a continuum. If you go back to when the concept of health information exchange was invented, and by the way, shout out to the Regenstrief Institute in Indiana, which I think invented the concept of health information exchange back in the early 90s, is we focused on patients are showing up for patient care, and data needs to be exchanged from other organizations to support decision-making in that way. And for many, many years, HIE was focused on exchange of data to support direct patient care. And that's still an incredibly important thing that health data utilities do. If you look at the definition of health data utility that CSRI offers, it says that two things are at its core: health information exchange and multi-stakeholder governance. And that it's a not-for-profit organization that is focused, however, on meeting the broad health data and analysis needs of the public and private sector. And that's really the big difference between narrow health information exchange, as the world learns to think about it as supporting direct patient care, and much broader uses of health data for policy making, to employers, to support research. There's a lot of organizations that I've encountered. Some of them are like totally supportive of what we're doing, and some of them are like, "Oh, your definition is wrong because I'm a state." Like, here's one I've gotten is I am a state-run HIE, which but I'm absolutely a health utility, and it's like, well, to what extent are you focused on and allowed to meet private sector needs for health data? Because often state-run health information exchanges are either literally not allowed to, for example, charge fees or do things that they would need to do to fully support the private sector. So that's not a shot at state-run HIEs.